Good afternoon, everyone. Welcome again to the 2024 FPA Virtual Conference. I'm Brandy Underwood, your Manager of Development, Research, and Advocacy at the Facial Pain Association. During today's presentation, we will explore the spectrum of complementary health treatments with a special focus on medical marijuana. Facial pain is not simple or straightforward, and neither is treating it. In addition to standard medical interventions, complementary health approaches can be a part of your overall healthcare management. Complementary and alternative medicine offers a range of options that can work alongside or sometimes in place of traditional medical approaches. These can include acupuncture, upper cervical chiropractic, biofeedback, vitamins, and herbal supplements. One treatment that has provided real relief for many people with facial pain is the use of medical marijuana. This brings us to the heart of today's discussion. It is my pleasure to introduce Dr. Jeffrey Fogel, a dedicated FPA board member and retired pediatrician who brings a personal and professional perspective to this topic. Dr. Fogel was diagnosed with trigeminal neuralgia in 2008 and geniculate neuralgia in 2013. His personal experiences and medical expertise, combined with his active role in the passage of Act 16, which legalized medical marijuana in Pennsylvania, equip him uniquely to speak on this subject. Before we dive in, I want to go over a few housekeeping items. On your screen, you should see an option for both Q&A and chat. We encourage you to connect with other attendees using the chat feature. Please reserve the Q&A for your questions, and we'll get to as many as we can following the presentation. I plan to monitor both, but using the designated option will hopefully allow us to get to more of your questions. Although presenters today may be doctors, they are not serving as your doctor during the Q&A and are unable to answer questions about your specific health situation. We request that you keep your questions general in nature, and we will do our best to select questions that will benefit most people living with facial pain. Without further ado, please join me in welcoming Dr. Jeffrey Fogel as he shares his insights and experiences. Dr. Fogel, to kick this off, can you share a little bit about how you became aware of medical marijuana as a treatment for facial pain?
Thank you, Brandy. Well, actually, it was quite accidental. I was in our Philadelphia support group, and we had one member who was from New Jersey, where it was legal at the time. And he was on, I believe, 35 different medications per day and couldn't eat and was wasting away to nothing. So he had been put on medical marijuana. And he came to the next support group meeting, and he gained back like 50 pounds, and he looked like a new man, and was down to taking just 3 medications a day. And it was quite impressive. And so at the end of the meeting, there is a possibility that he might have dropped a joint on the floor, and I might have picked it up. And about 3 weeks later, I was having a bad pain episode, and I smoked the joint, and about 5 minutes later, I just turned to my wife and said, "It's gone." It's just, the pain was just gone. It wasn't muted. It wasn't lessened. It was 100% gone, and I could not believe it. I would never have believed it if anybody had told me. So from that day on, that's when I became a disciple and started to do everything I can to get it at first passed in Pennsylvania and then hopefully changed nationally.
Oh, thank you, Dr. Fogel, for sharing that personal story. That's an incredible way that you found that it works, and I'm so glad that it does for you. Next, I would like to ask a few of the most common questions I hear from people with facial pain about medical marijuana. So I understand that medical marijuana is a complex drug. Can you explain what it is and why it would help facial pain?
Gladly. Well, marijuana, unlike most of the drugs that you get, in a pharmacy, since it's made from a plant, has a ton of different compounds in it. There's over 100 cannabinoids. I think last count was like 115. There's flavonoids, which are naturally occurring compounds. There's also terpenes, which give the aroma to it. So it's easy to see why, you know, one size does not fit all. Again, it's not like, you know, Tylenol, that it's just one compound in there. What we need to do is to focus today on the two main cannabinoids, which are THC and CBD. THC is also known as tetrahydrocannabidiol, and then there's cannabidiol. Well, CBD. We'll call it CBD. Now, THC and CBD have been shown they have to be together to work for true central neuropathic pain. CBD works, so, you know, can work for localized pain, but for centralized pain, you really need the two together in some kind of ratio. Now, THC is further subdivided into two strains. The first one is indica, and indica is the one that has the more relaxing, tired effect on you. And the other strain is called sativa, and that gives a more heightened sense of awareness. Nowadays, the way they have cultivated the plant, they've also got a third type, which is a hybrid of both the indica and sativa. So when you're getting medical marijuana, you're getting either indica, sativa, or the hybrid in combination with the CBD in some ratio and in some concentration, you know, some strength. So it doesn't you don't necessarily need a lot of the THC to get the synergistic effect. Some people get good relief with as little as a 10-to-1 ratio of CBD to THC. So that's a way to get around the feeling of high and the side effects that THC can give by just using a little bit in there. Although some people will find that that won't work as well, and they will need a higher strength of THC.
Could you share a little bit, you know, is all CBD created equal?
Well, CBD is the reason why CBD is legal in certain places and not THC is because CBD is derived from hemp. And you've probably noticed the real boon in the CBD availability now. And that's because in 2018, there was a farm bill that was passed that made hemp legal. So they withdraw the CBD from hemp, and it takes a process to extract it. And it's an unregulated product. The problem with CBD is that since it comes from hemp is what's known as a bioaccumulator. And what that means is that it pulls things out of the soil and keeps them within the plant. So the extreme example is what they're doing in the area around Chernobyl. You have all the uranium from the nuclear reaction. They plant hemp plants there. They pull the uranium out of the ground. They then cut down the plants, remove them, and plant more hemp. So when you buy CBD at your gas station, you do not know what you're getting in that product, unless you get one that comes with like a 3-page summary listing all the stuff that's been tested for. Then you can be pretty sure that you're getting good stuff. But if you get cheap stuff, I'd be very cautious about using that.
Oh, thank you for sharing about that. I read a recent article that you wrote that talked about the different ways that you can take medical marijuana, whether that's inhalation or tinctures or edibles. Could you discuss the pros and cons of each of those three, of inhalation and tinctures and edibles, for managing acute episodes of facial pain?
Good question. Yeah, a lot of it depends upon what you're trying to get and what you're able to take. The inhalation, as I mentioned from my own personal experience, that works the quickest, gives you a very, I shouldn't say the word high peak, but the greatest peak in terms of efficacy. But then it wears off quickly, as you can see on that curve there. The tincture, which is drops that you take by mouth, they come in a little dropper bottle, kind of looks like eardrops. That takes a little longer to work. It hits its peak usually around 30 to 45 minutes. And it lasts longer. It doesn't give you as big of a peak as the inhalation does, but it's still a pretty darn good peak, and it lasts 4 hours or so. And then you have the edibles, which give you a very, very slow absorption rate. So it's a very slow, insidious onset of action. Most people don't even know that it's building up and having an effect because it's so slow. Peaks at about 3 to 4 hours and can last up to 8. So the edibles are really not well suited for an acute episode, but they are very well suited for somebody who is, having chronic pain and wants to not have to take some doses every, 2 hours. It's also better if you're, at work, or places where you can't smoke, to give you an option in those situations. The tincture is really a good medium ground because it gives you a real nice level. It works relatively quickly and lasts a relatively longer time than the inhalation. So in my mind, it's got the best of both worlds for acute pain episodes.
Thank you for sharing that. It's very helpful to see kind of how each of those play out depending on what your needs are, especially when you're in an acute episode of facial pain. Another question, did you want to add to that, Dr. Phillips?
Just to say that many people, in case people didn't know, that with the tincture, all you do is you place the dropper underneath, put the drops underneath your tongue or between your cheek and gum, and just leave it there for as long as you can, and it gets absorbed through the mucous membrane. So it's still oral, but it's being absorbed, through mucous membrane rather than going through the stomach like the gummies do.
Thank you for sharing that. Is that typically like sublingually, or can you just put it on your tongue?
Yeah, you put it under your tongue sublingually or between your cheek and gum.
Thank you. As we talk about, the different types, one consideration, which is what are some of the legal and even social hurdles patients might face when opting for treatments like medical marijuana, and how can they navigate these?
That's also a good question. In terms of travel, since marijuana is illegal at the federal level, it is technically not legal to even go from one state that has medical marijuana laws to another state where medical marijuana or marijuana in general is legal. However, as everybody knows, there's no border police, between Pennsylvania and Maryland. They're going to check your car to see if you have any marijuana when you cross the state line. So that's not realistically an issue. In terms of flying, big difference between domestic and international. Domestically, the TSA is, if they do find marijuana on you, they're not allowed to do anything other than call the local police. And if the police come and they see how much you have, and if they see it's for medical reasons, in most cases, they're just going to say, have a nice day. The drug sniffing dogs have actually now been desensitized to the odor of marijuana, so they don't alert on marijuana anymore just because it's so prevalent. That's different than internationally. Internationally, totally different ballgame. For example, in Saudi Arabia, the penalty for being found with marijuana is death. And I'm not kidding you. That is the absolute truth. And the State Department can help you. You're on your own. So I absolutely would urge people not to travel outside the country with marijuana. Um, Not recommended to do it internally either, because federally it's illegal. But hopefully in the future that federal regulation will change. Um, some states are decriminalizing it, but yet even as they're doing it, there are other states, for example, Idaho, that actually just increased the penalties for marijuana. Um, so that's traveling. Socially, there is a stigma because marijuana is still classified as a Schedule One drug, but I think that stigma is lessening now that more and more states are approving it. Then there's the balance of how do you balance, between having pain while you're at work and getting pain relief from a drug that is illegal on the federal level. I think in situations like that, you may need to consult a lawyer for the issue of disability accommodations, but that's going to be an individualized situation. And that's also why I mentioned in the beginning about how being at a workplace, smoking may not be an option, and that's where the tincture again could come into play.
Thank you. With the varying state laws that you mentioned regarding medical marijuana, what advice would you give to patients or even healthcare providers in states where it's not yet legalized?
Um, I hate to sound cavalier and say move, because obviously people can't do that. But there are right now, I think it's 14, excuse me, 14 states where it's not legal. Now these states do allow for low THC CBD oil, which is less than 0.3%. To give you a comparison, the THC in medical marijuana is between 10 and 20%. So you're going from 0.3 to 10 to 20. It's a big difference. So those states, just for anybody who might be interested: Alabama, Georgia, Indiana, Iowa, Kansas, North and South Carolinas, Tennessee, Texas, Utah, Wisconsin, Wyoming. In addition to that, Nebraska and Idaho don't even allow the low THC CBD oil. They are absolutely zero THC. Kentucky just passed a law in 2003 permitting medical marijuana, but unfortunately, it doesn't take effect until 2025. So the other thing about those 14 states is they don't have a thing called the ballot initiative. Those states all have in common Republican legislatures, and in states where there's a ballot initiative, then the citizens can actually propose a law by petition to be put on the ballot. But if they don't, since those states don't have that, the citizens in those states are totally dependent upon the legislature to come up with the law.
Thank you for sharing that. So, what do you see as the future of medical marijuana and the treatment landscape for facial pain? And how can patients get involved in research or even advocacy to help make this more accessible?
That's also a very good question. I think for that, we need to take a step back and look at this with a bit of a broader brush, because in order for someone to advocate for change, you have to know where we've been and where we need to go. So let's take a step back, look at the DEA scheduling of drugs. The Controlled Substance Act was created in 1970, and they didn't know how to classify marijuana at the time. It had been legal prior to that up until 1937. So they created the Controlled Substances Act, which has 5 different schedules, ranging from 1 down to 5, 1 being no accepted medical use and a high potential for abuse, to 5 being very useful and low potential for abuse. So Schedule 1, for an example, is heroin and LSD. Schedule 3 is something like Tylenol with codeine. Schedule 5 is cough syrup with codeine, so very low ability to abuse it. Now, everybody's heard about the fentanyl overdose crisis that we're having now. There's over 150 people dying every day of overdose to the synthetic opioids. And fentanyl is 50 times stronger than heroin, 100 times stronger than morphine, and it is Schedule 2. So it's permissible for any doctor to write it. And even though it's stronger than heroin, and heroin is Schedule 1, fentanyl is still okay to be used. And I think that's part of the problem that we have in this country, and that the whole scheduling needs to be reviewed. So if we go back to 1970, what happened is, since they didn't know where to put marijuana, they put it in the same category as heroin, that Schedule 1, just as a holding place, formed a commission to figure out where it should go. And the commission said, well, it probably should go in Schedule 3, which is the same as Tylenol with codeine. The president at that time was Richard Nixon, and he rejected that finding. So the commission's report never went into effect. And as a result, just by a freak of history, marijuana stayed in that Schedule 1. It shares nothing in common with heroin, but it was just stuck there. And that's where it stays to this day. So if we want to advocate for it to be changed, we need to know why it's there. It doesn't share any of the properties. It was just one of those things that history forgot about. And I do think it needs to be changed. There's, when you compare the safety of it, I don't know if you know, but there's never, ever, ever been a overdose death from marijuana. And one pharmacist had found that you would need 1,500 pounds in 15 minutes to get a lethal dose. That's almost a ton, so it's obviously impossible. So that makes it safer than Tylenol, safer than aspirin, even safer than water, because you can overdose on water and die from electrolyte issues. So it's the safest product out there. So there is a real big difference between it and heroin. So I think we're really doing the public a disservice by not addressing that. Now, in all that matters because in this past August 23, the Department of Health and Human Services recommended reclassifying marijuana as a Schedule 3 drug, which would be perfect. And this may come to play in 2024, but whether that happens or not is going to depend upon the election, whether politicians who are look favorably upon medical marijuana are elected or not. It's because it's going to be up to the Senate and the House to, approve that or not.
Thank you. Thank you for answering that and for sharing that. Some of the work we're doing here at the FPA is trying to make an impact on that national policy level. Do you feel that really is where our efforts should be, and partnering with organizations who, also advocate for medical marijuana, the epilepsy community, other organizations that are, trying to have this legalized on a national level? Do you feel like that would be the best use of our efforts?
Oh, absolutely. It's really, this state patchwork that's going on. It's a nice stopgap measure, but I feel so badly for when I get a call from somebody who's in a state. I just talked to someone earlier this week. They're from Tennessee, and they look, and there's states right next to them where they could get it if they live there. And it's like, holding a carrot just beyond somebody's reach. And it breaks my heart that we're doing this on a state by state basis instead of on a national, federal level. So it really shouldn't happen. You shouldn't have a pharmaceutical product be in the political realm. It should just be what's in the best interest of patients.
Thank you so much. I'm going to kind of take a turn to more of, how medications like medical marijuana are classified as, complementary and alternative medicine. What distinguishes them from traditional medicine? Is it, having that FDA approved medication or it being part of a clinical trial? Could you talk a little bit on that? And then I'd like to open some questions from the audience.
Sure. Basically, you can look at it that, complementary medicines are exactly that. They're complementary to the standard traditional medical forum. So that would include things like upper cervical chiropractic, acupuncture, nutritional supplements, hypnosis, things like that. Then you have regularly approved drugs which are used in an off-label indication. So, for example, Botox would be an example of that, where it's approved for certain conditions, but not for others. People use it for the off-label, and if it works, that's great. I'm all in favor of basically anything that works. Any tool in the tool shed is a good thing if it helps us with facial pain. So not just marijuana. I know that's what the main focus of this talk is, but I look at it as just one thing. If it helps you, that's great. If you find that you're not interested in it, there's a bunch of other options out there. There's, Dr. Leakey's talk on the different medications. There's the more options that we can have for people, the better.
Well said. Well said, Jeff. I have a question here from Robert. He asks, can medical marijuana be used to treat anesthesia dolorosa?
Good question. And it's also one I've never got before, and I don't know if it would work. Unfortunately, because marijuana is not legal on the federal level, you can't have any research in it. So there's no funding. You can't get an NIH grant. You can't do any of that stuff. So we have to look at foreign countries for research. Most of the good research has come from Israel. And I do not know if they've ever looked at that to see if it works. I could check into it. And do we have a way to respond back to Robert?
We could formulate a list of questions and answers that we could provide and add it to the platform after the conference.
Okay, that'd be good. I'll check into that.
Thank you. It was a great question. You touched on this a bit during your talk, but we have a question from Marilyn about how does one find the correct dosage or ratio of THC to CBD, and how can it be obtained at the medical marijuana store?
Okay, also that goes back to the fact that, one size does not fit all. Unlike, we'll go back to that example of Tylenol again. You have two strengths. You have regular strength and extra strength. And if you take the regular strength and it didn't work, then you try the extra strength. And if that doesn't work, then you go to something else. Because there's so many products in marijuana, it's not like, well, if this one didn't work, then marijuana doesn't work for you. You have two main things to consider. You have the ratio between the THC and CBD that I mentioned earlier. And typically what we do is we start with someone on a higher CBD to THC ratio, and then over time build up the THC and drop down the CBD to the point where they find that it works. So you can have a 10-to-1 CBD to THC, a 5-to-1, 1-to-1, 2-to-1, 1-to-2, 1-to-10. So you can have the whole gamut. And the second thing that makes it a little bit more confusing is the strength. So you could have, 10 milligrams of THC, or you can have 20 milligrams of THC. And you're looking then at the 20 milligrams THC to 2 milligrams of CBD, that's 10-to-1, or is it 20 milligrams and 20 milligrams? So or you can 10 to 20. There is so many different possibilities that a lot of it is trial and error, and you just have to start with one and just keep working. Personally for me, I hit the one I like that works best for me on my fifth different product. So I typically recommend, if you're going to a dispensary, to get the smallest one you can, so that if you find it doesn't work, you're only wasting $10 or $15 instead of 60. But it can take. One pharmacist told me he had one person that took him up to a year of trying different products before they finally found the one that worked for their TN. But on the other side, he didn't have anybody who had TN who didn't respond at all. So that's an encouraging thing. Just takes some work.
Absolutely. And a great way to get kind of feedback, those who see multiple people with facial pain using this medication. So I have a great question from Anne. Good afternoon, Dr. Fogel. Why should I go to a medical marijuana dispensary when I can get marijuana legally without a prescription?
All right. Well, that was part of when that last question, when it said the medical marijuana store or the marijuana store, I was thinking that exact question myself. The main difference is that with medical marijuana at a dispensary, you get to meet with a pharmacist. They go over your medications, what you're currently on. They find out about your disease, what you're trying to get out of the treatment. Do you need it more for daytime? Do you need it more for night? Are you having to work and you need to be productive? All those different things. When I met with the person in Pennsylvania, it's an hour meeting with the pharmacist, who then tailors something to your needs and adjusts it. Going to a place a state where marijuana is legal, you're just going in and getting, a 19-year-old, what they call them, bud tender, who is just, saying, well, here, try this, and doesn't have the medical background to be able to help you. So yeah, you may stumble on the right product, but you might not. And you might end up going through more products and trial and error than you need to. In fact, I get a lot of questions from people who live in California because they're lost. They go into these places, they can get anything they want, and they just don't know what to get. So that's the first part of it. And the second part of it is that in states that have both medical marijuana and recreational programs, you're allowed to carry more if you have the card for the medical marijuana program than you can when you're just getting the recreational.
Thank you. Very informative. I have another question about the dosage, and it's from Shane. What is the recommended dosing when using a THC tincture for neuropathic pain?
Okay, and that goes back to what we were talking about before, that it's not so much the dosage, it's not so much the vehicle, the tincture versus smoking versus gummies. It's the dosage, the amount of THC and the ratio of THC to CBD. What we do in many situations is get somebody to start with the inhalation, because it's real easy to adjust the dosage. Then if you take the inhalation and in 5 minutes, 10 minutes, it didn't work, well, you can take another dose. And then if 5 minutes later you need another dose, you can do that. And then you can figure out, okay, I needed this many milligrams of THC because that's what it took me over that time period. Then you can convert that into the tincture. So we want to try not to confuse the delivery method, which is the inhalation, tincture, or gummy, with the dosage, which can stay the same basically across all three. So you look at, you try and get what works, what strength works, and then convert that over to the next type. Tincture, again, if it doesn't work, you can take another dose in half an hour to 45 minutes. Gummies, you can't do that at all, because if you have to wait 4 to 5 hours to see if it works, if you take another gummy, then that gummy is hitting its peak when the first one's gone already. So you really can't adjust dosage well with gummies. You're much better off doing it with inhalation, or tincture is most common.
Thank you. So it's you have more ability to control and kind of figure out what the best combination is for you with those two options.
Correct. Then once you get on a stable dose, then I think gummies are great for people who, need repetitive dosing. But it's just very, very tough to figure out what dose is going to work for you with a gummy. Much easier to do it starting with one of the other products and then jumping over to the gummy.
This is kind of my question as a follow-up. Is there a better time of day to take different items? Like, is it better to take gummies at night and take, inhalation or tincture in the morning?
Again, that's based upon what your needs are. If you're having problems sleeping, then gummy would be a good option. But there are some people who have bad pain episodes at night. Well, then you don't want to take the gummy. You want to do an inhalation for that. But can you take an inhalation and a gummy at the same time? Absolutely, because remember that the gummy is going to be hitting its peak in 4 to 5 hours. The inhalation is going to be gone in 45 minutes to an hour. So there really isn't any overlap. You can take a tincture at the same time as inhalation, as the gummies, also for the same reason. So you have the option of taking both acute treatment as well as more chronic treatment, as in the gummy, at the same time. That's the nice thing about it. It does give you that variability to do as you need. A lot of people, I would say most people who use the gummies use them during the day, so that they're not having to dose over and over again.
Thank you. Here's a question. I'm going to ask it a little bit more general. Are you aware of THC interfering with, commonly prescribed medications for facial pain, like carbamazepine or lamotrigine, for example?
Not that I'm aware of, and not in any significant degree. There's always possibility that some can. Again, we get into that same problem that, it can't be studied because it's not legal on the federal level. So the drug interactions, again, we're looking at, foreign countries who don't always have the study protocols the way we do here. So it's usually smaller groups. So it's tough to make broad recommendations, but there hasn't, been anything that I know of that has said you shouldn't take this with marijuana. I don't think that is out there at all. I'm on lamotrigine and hasn't affected my levels at all either. So, I just have never, ever seen anybody who has a problem with their medication dosage because of taking marijuana.
Thank you. There are several questions about some of the comorbidities you see with facial pain, particularly anxiety, depression. Do you feel that, or do you know if taking medical marijuana helps with kind of that emotional component to pain, or can you speak to that?
Yes, it does. Remember, one of the things that indications for medical marijuana is, things like PTSD and anxiety. So it's indicated for those issues. And actually, that goes back to the individual patchwork of state regulations. When you look at what states have approved it for what indications, it's amazing. And, some states don't have chronic pain as an indication, which, blows my mind that they don't have it for that. Some have it for very, very few indications. But to go back to the point, it is used for those types of conditions. So yeah, the problem that we have is that certain people will get anxiety from marijuana, from the THC component. So for those people, what we can do is we use a lower strength of THC. So like I mentioned, for people starting out, we might use a 10 to 1 CBD to THC for them, so they don't experience so much of the anxiety that certain people can get. Most don't, but certain few do. So you want to be able to tailor it. Again, that's the nice thing. There's so many options that of dosages and strengths that you can pretty much tailor it to what anybody needs.
Thank you for your answer there. Megan Hamilton asked a question. I know there are many different strains of marijuana that work better in treatment symptoms. Is there a good resource for learning more about these strains and different treatment options?
I guess you can do some literature searches. Again, we go back to the fact that there isn't really good studies because of the situation. So you kind of just have to pick and choose. Again, that's the advantage also of having a state that has a medical marijuana program, because you can then talk to the pharmacist who, to me is the guru of the different dosages and strengths and strains. They know their stuff, just like pharmacists know more about medications than most doctors do. They're really in tune because that's all they do is work on the drug. So again, another reason for having a state have the medical marijuana program versus recreational. I think states that have recreational do a disservice to people who need it for medical reasons.
Thank you. There's a couple of questions or comments about, for example, on a drug label for Cymbalta, it mentions that taking Cymbalta can increase the effects of medical marijuana or other labels. Is there a website you recommend if someone is concerned about an interaction or, someone else also mentioned about medical marijuana and its interactions with clonazepam. Can you give some advice on where they might go to find more information?
Other than the DEA, the med search is there, which is the same things that you get when you're given the drugs, the 4 pages on drug interactions. But I'm not aware of any one source that you can go to. Again, I can look that up and put that on the site when we find it.
Thank you. Here's a question from Andre asking, do you have any opinions on CBN, THCV, CBG, CBC, etc.? I'm assuming these are acronyms for various combinations. I don't know if this would be medical marijuana or if this is more recreational.
Yeah, they may be recreational. Every different, even if it is medical, every different state has different products that all go by different names, and the name itself does not mean anything. And it's not like you can get again, we'll go back to Tylenol. Tylenol in Connecticut is the same as Tylenol in Florida and in California. These have all different proprietary names. And so it doesn't tell you anything just by knowing the name. You got to look at what's in it, what's the strength, what's the ratio.
Thank you. Someone here asks, it can be very difficult to speak to your doctor or to even initiate this conversation of medical marijuana. As a person who uses medical marijuana and as a retired pediatrician, do you have any advice on how to really start that conversation with your healthcare provider?
Well, many healthcare providers don't really feel comfortable with it. And in medicine, often, unfortunately, what happens is if we don't feel comfortable with something, we kind of push it aside, push the concerns away, which is a real disservice to patients. But if when we get out of our comfort zone, I don't think we do as well in service to our patients. So that being said, if you're talking to your physician and they don't feel comfortable, then you want to find a person who does. In the states that have the medical marijuana programs, they will have specific doctors who are approved for the program. They've gone through specific training to get approved, and they're the ones who can be we call them recommenders. You can't be a prescriber of it because you can't write a prescription since it's not legal, but you can recommend it. You can give a piece of paper that says that you're recommending the person for the medical marijuana based upon their medical condition. But to that would be the place I would go. Again, now we get into the states where it's permissible recreationally, but not medically. You have to try and go by word of mouth, and who has someone else spoken to that seems sympathetic and understanding and knowledgeable, and that can be a while. Even in Pennsylvania, it took me 3 people till I found one who really, even though they're in the program, knew what they were talking about.
I see. There's a question here. I'm going to kind of generalize it. If someone only can achieve relief with gummies that have strong THC, but they also need to work during the day, and that's kind of interfering with their ability to complete the work they need to do during the day. Do you have any recommendations for helping them find a balance between, again, that higher THC, so they're achieving pain relief, but are able to still continue in their careers?
Okay, that's good. Again, that goes back to the beginning when we talked about the strains, the sativa and indica. I would want to see in that gummy, does it have an indica strain or a sativa strain or the hybrid? Because in order to be working, people who are working typically find that they do much better with the sativa strain. It doesn't give you that, tiredness and the relaxation, and it gives you more of a energetic and focused effect. So, see what's in the gummy. It's not just the THC, it's which THC do you have.
Thank you. Thank you, Dr. Fogle. Here's a question. Is there a reason I might not want to tell my physician that I take medical marijuana? And then I guess a follow-up question would be, is it important for you to tell your physician that you are taking medical marijuana or even recreational marijuana?
I think it's important because I think it's important to tell your physician everything that you're on. That includes nutritional supplements and anything that you're taking, be it over the counter or prescription. You really need to, in order for a physician to take full care of you, they need to know everything that you're taking. If you think that your physician has a bias against taking medical marijuana or marijuana in general for your condition, then I would question how much that physician has your best interests at heart, because they shouldn't take their personal feelings about it into your situation. They should want to do what's best for you. And so I would take a good hard look at that stance. And personally, I would not be satisfied that physician has my best interest at heart.
Absolutely. Who prescribes medical marijuana? Or does that really depend on the state that you live in? And then how do you find out that information?
That's a good question also. Every state has its own protocols that you have to go through. In most states, you can go to the Department of Health, and in there you'll find, it may take some navigating, but you'll find information about the program. that won't be there in states with just recreational use, but it will be there in those states with medical marijuana programs. Brandy, I thought if we're gonna, do we have the ability to put the link up to the quarterly from June, the summer of, was 2019, I believe? Because in there, I have a listing of all the states that were legal at that time, which is still most of the ones that are now legal. And there's a link in there on each one to get you to the site in that state's Department of Health or whatever organization it is that is responsible for the program, and that walks you through step by step of what you need to do. Again, you're not going to have anyone prescribing it. They will be, approved physicians in the program or whatever they want to call it. But it varies from state to state. There is no two states that do it exactly alike. There's no two states that have the same exact indications for its use. So again, that goes back to the advocacy for getting it approved on a federal level so that we don't have this patchwork quilt that we have now, which is just so difficult for patients to navigate. And it really shouldn't be that way. It helps so many people. It really shouldn't. It shouldn't be that so many people have to jump through so many hoops just to get it.
Yes, and when we're talking about accessibility for these treatments and for people living with facial pain, if they don't live in urban areas, I can't imagine that they would have access to these dispensaries, to these options in rural locations. Any thoughts or information that you have on that?
Again, it's statewide. I just read a few days ago that Louisiana has a medical marijuana program approved. They have 2 places in the entire state that you can get it. 2 in an entire state. So yes, it's approved, but realistically, most people can't access it. And so it's as if it's not approved in that state. If you have to drive, 4 hours, I think that's, for a person in pain to have to drive 4 hours to get a treatment that could possibly relieve it, that's just, it's cruel.
Unacceptable.
I'm at a loss for words because it upsets me so.
Thank you for your passion to help people with facial pain. Here's another question. How long does THC stay in your system? Say you use a gummy and you're subject to a random drug testing.
Also a good question. That's been shown that it really matters how much you take, how often you take it, and the method that you take it. So if you smoke one joint and you haven't smoked, for a week or 2 before that, then it's probably going to be gone, that evening or the next day. If you smoke on a regular basis or you take gummies on a regular basis, it's going to be there for longer, and it can be a couple of weeks. The problem is that there is no test that tells us what level is impairment or not. So unlike with, alcohol, you have a level of 0.8, 0.08, and that's it. You're considered drunk if you're, a 1, and you're not if you're below the legal level. With marijuana, that doesn't exist. It just says you've got some. So they're working on tests that will now tell you whether it's clinically significant amount or not, but they're not typically available just yet.
Thank you. Is it safe to assume that most professional licenses or other licensure that would require you to be drug tested, given the lack of national, acceptance of use of medical marijuana, that would be, still picked up as a drug and still picked up as something that would be flagged?
Yes. I'm not sure if they would pick it up, but whether they would hold it against you, that is something that I don't know. And I guess that would vary from industry to industry. Um, I know probably in the trucking industry where, there's virtually zero tolerance for alcohol, they'll probably have a different criteria than, a industry where, a plumber, for example. And again, airline pilots who are, not not permitted to have any significant level. I think their levels, just like for a CDL license, 0.03. So, I think each different industry is going to look at it a little differently.
Thank you. Thank you. We have time for maybe one, maybe two more questions. What biological process might cause marijuana to worsen pain in certain people?
I'm not sure I'm understanding the question. What process? Do you know what's meant by that or not?
Yes, this person had shared that, when they use medical marijuana, they find that it causes more pain as opposed to lessening their pain. Are you aware of anything that would cause that?
No, I would just wonder if it's not working and therefore their pain was increasing and they just didn't get any relief from the marijuana. And I would advocate trying different preparations from what they've tried. But I've never, ever heard of it increasing your pain.
Okay. There was one question, again, asking more for more information about the ratios of THC and CBD. I think it would be helpful for us to link those resources that you've provided in the past, the articles from 2019, as well as the article you most recently published in our quarterly journal. Are there any other pieces of information or advice that you give that we could provide to those who've attended today regarding the THC-CBD ratios?
Yeah, one of the things in the quarterly from 2019, there's a very well written article by a pharmacist in the Pennsylvania medical marijuana dispensary, and he wrote it from the point of view of, you're a patient coming in to see him for the first time. What questions does he ask you? What questions does he typically get? And how does he work it through with you to get something that works? The other great article in there is written by a person who was a provider out in New Jersey, who was a physician who would be this. He wrote it the same way. When a person comes in, what would I ask them? What would they want to know? And so it's written really from that standpoint rather than being a lecture kind of an article. So I think both of those are wonderful articles to read. And you've got the link on there.
Wow, Dr. Vogel, this has been an incredible discussion today, and I cannot thank you enough for your time and for helping us understand how medical marijuana can help people with facial pain and what next steps we need to take to help make this treatment option more accessible. We've touched briefly on research and advocacy during this session, but you can learn more during Dr. Lim and Dr. Zhu's discussion on research in the facial pain space later today, and during a special presentation tomorrow on Advocacy 101, what is advocacy and why does it matter? If you would like to learn more about complementary health approaches, self-described facial pain warrior and holistic wellness guide Kayla Harley will offer a 5-minute video on her experience with pain, nutrition, supplements, self-care, and how she copes, starting in 5 minutes at 3:05 Eastern Standard Time, 12 p.m. Pacific. Just navigate back to the agenda on the homepage and select Tell You My Story. At the end of the day, Kayla will offer a short Q&A session to connect with the community and answer questions about her videos and experience. The next session following Kayla's video will begin in 15 minutes, where Dr. Johnson will give a presentation on stabilizing the rough seas when you receive dental care as a person with trigeminal neuralgia. That will start at 3:15 p.m. Eastern, 12:15 p.m. Pacific. Thank you so much for being with us today.
Thank you.